Have you ever had a doctor that was super insensitive and had no bedside manner whatsoever? On May 20th, 2014, I experienced a doctor that was really insensitive and had no bedside manner. Um, all my dreams were crushed on that day by this one OBGYN. She um, did an ultrasound on me and then did a pelvic exam, which failed. And right after she was done doing my pelvic exam, she sat me up and was like, "Hey, you don't have any uterus. You can't have kids." She's really heartless and broke all my childhood dreams. Um, that night, I had not gotten a diagnosis yet, and I was wondering, hey, am I the only girl that is experiencing this and the only girl that doesn't have a uterus? So I went online and looked through websites, and I came across youngwomenshealth.org, and it had an article featuring MRKH and had questions related to that, which really helped me that night to get over, like, hey, I'm not the only one that is going through this. I'm not the only one that's going to go through this. You don't know what MRKH is? You're not alone. I've had many physicians ask me, what is that? When I'm asked, hey, do you have a period? I'm like, no. Don't have one. Never gonna have one. Have MRKH. This syndrome is named after the 4 doctors who discovered it. It is called Myers-Rokitansky-Kuster-Hauser syndrome. It occurs in about 1 in 5,000 women. There's 2 types of it. Type 1 is just absent uterus and absent upper vagina. Type 2 can include skeletal abnormalities plus the absent uterus and vagina. The symptoms are just you don't have a period. You have normal pubic hair development, normal breast development, normal external genitalia. Everything's normal, but not having a period. The causes are completely unknown. They first thought that it was environmental. Then they thought, well, maybe it's genetics. Right now they're thinking they're more leaning on the genetic side. They're thinking it is a autosomal dominant trait. Went to a conference in September, at the very end of September, and Lawrence Layman was one of the speakers, and he is in charge of the reproductive endocrinology at the Medical College of Georgia at Augusta University. He's in charge of a study that I have participated in. They're trying to find the cause of MRKH by taking blood samples from girls who have been diagnosed and family members that are willing to get their blood tested for this research. My brother and mother, dad, and his mother all participated in the study along with me. They are still working on this study. As of right now, they're wanting more girls and families to participate so they really can find the cause. There's no cure. There's just treatments. The main treatment that they do right now, they'll first encourage dilation, which is painful. All of the treatments are painful. Dilation includes a plastic, I don't really know how to explain it, but it's a plastic piece that you push against, you insert it into your vagina and just push against like the resistance to create a vaginal canal. There are several surgeries. 3 of them I'm going to talk about. McIndoe procedure includes taking skin grafts. They can order skin grafts. They can take skin from the back of your leg. And what they do is they just cut into your vagina and create a vagina out of that by using the skin graft. The Davidoff procedure uses a patient's peritoneum, which the peritoneum lines all your organs, and so they just go up in there and make like kind of a tunnel for the vagina. And then we have the Vecchietti or Vachietti. It depends on how you want to pronounce it. I had that procedure done, and it involves having a metal plate laid across your abdomen, and there are strings attached on the metal plate that is connected to a olive, they call it, that comes up through your vagina. Once you pull on the strings, you can pull on the strings every day or every other day. None of these treatments are pleasant. They're all very painful. Usually after surgery, the patient will have to dilate to maintain their length. It's a very emotional process and very hard on your body. There's a lot of lack of awareness, which is mainly why I chose to do the presentation on this topic. A lot of doctors don't know what it is. Like I said, I've gone to a doctor and been asked, how do you pee? The answer is the normal way. Nothing's wrong with my urinary system. And how doctors talk can really influence how the girls feel about the syndrome. There's really lack of knowledge, like I said, and I think it's very important for physicians to know what it is so they don't make a negative connotation to the syndrome. The mental aspect of the syndrome, I think, is the hardest. Being a girl who has it, I don't feel like I'm as much of a woman as other women, or like, am I ever gonna find someone that really loves me and accepts, hey, I can't have my own kids, kind of thing. There's been girls that have committed suicide over finding out that they had this syndrome, which is terribly sad. I think there just needs to be much more of a awareness about it and encouraging counseling for it, because it's really tough. It's a really tough time when girls are diagnosed, because they're usually diagnosed during their teenage years. They're forming into their new person, plus they have this new diagnosis. It's really hard to deal with all of it. I had the Vecchietti procedure in December of 2015, and let me tell you, it was not a piece of cake. I had difficulty urinating after surgery. I was constipated. I had to change my pain meds 3 different times because they either weren't working or I was throwing them back up. I had the olive taken out without being put under. And that surgery in general, just the after effects of it, that was the worst pain I've ever been in my life. I try to help others that have been recently diagnosed or have questions about surgeries. I try to give them advice and just be there for them, encourage them, because it's really hard to deal with this, and you really feel like you're alone, because especially when you live in a small town like Silva, because you're like, well, there's probably not anybody else that has this syndrome. I'm just sitting in this town alone. But there are definitely support groups that help. I'm part of several, ones of them, and I hope to keep encouraging women that have been recently diagnosed and just keep on trucking, because everything's gonna be okay.